Good morning and welcome to this edition of San Diego People. I'm Ross Becker. Healthcare insurance open enrollment is once again underway here in the United States, and of course with it comes a lot of confusion. When do I have to enroll? What do I qualify for? How do I apply? And what if I can't afford it? Well, today on San Diego People, we're going to try to answer all those questions for you, and we're also going to look at how our healthcare system here in the U.S. stacks up against the rest of the world. Joining me first is Leticia Cazares of the San Ysidro Health Center. Hi, thanks for being here.
Hello, thank you. Thank you for having me.
Hopefully we can end some of this confusion. Every time we get to this period of open enrollment, people's eyes start to glaze over and they don't know what to do, particularly if they don't have insurance, because there's a fear about cost and all kinds of things. So explain to us during this open enrollment period, when is it, and if we don't have insurance, what should we be doing?
Okay, well, to start off, open enrollment started on November 1st. It ends January 31st, 2016.
And this is for so-called Obamacare and the way it's administered here in California, right?
Yes.
Okay.
For California, it is the state health exchange. We call it Covered California. Mm-hmm. Other states who don't have their own state health exchange are the federal health exchange or Obamacare.
It works kind of the same way, though, doesn't it?
It does work the same way. Mm-hmm. We have our rates for California set by California.
Okay.
And California health plans. Mm-hmm. So open enrollment is now. Mm-hmm. It is for those who do not have health insurance, and for those who have health insurance, have a Covered California health plan or other plan, and they just want to review their options because the monthly premiums have changed. Some have gone up, some have gone down, so it's really important to take a look at what your premium is to see if there is a better option for you. So people can do that a number of ways. They can call the Covered California phone number, talk to a representative over the phone, or they can get in-person help here locally. They can do that two ways. They can call the 211 easy number. It's for all support services. They will give you a list of different sites around San Diego that you can make an appointment with a specialist, and they will go over in detail your options.
Okay. Stop you a second, because that scares me right away. It says, is there a better one to go to? Are they all working out of the same exchange? This isn't a different product depending on who I get shuffled to, right?
No, and that's a very good point to make. In order to provide this in-person assistance, we are required, because San Ysidro Health Center is one of those sites, to get certified and trained by the state, by Covered California, to be able to provide the same information. There's no pressure, there's no sales tactics, it's free, and that's another point. If anyone is trying to sell this service of consulting fees,
helping you find the right insurance
for a fee, it's illegal. So it needs to be free. And so people, like I said, can call Covered California, or they can plug in their zip code on the website, and there will be a list of different sites, including San Ysidro Health Center, different locations all throughout the county, to be able to provide that in-person assistance.
All right, let's talk about fear about money. I mean, a lot of people are struggling, and particularly if you don't have health insurance now, there's probably a reason you don't have health insurance, and that is because you're living on a very, very tight budget. And so it is frightening to even ask for help, because you know at the end there's going to be a bill. Right. But there may be some help with that, right?
Yes. Actually, Covered California recently came out with statistics, and we find it to be very true that the majority of people who are applying for Covered California are getting financial assistance in the form of tax subsidy. In fact, 90%. And so there is a lot of help out there. Now, affordable is relative.
Correct.
So, of course, for those people who have never had to pay for health insurance, this is going to be a big cost, no matter what, even if you do get financial assistance. But people would be very surprised at how much will be their monthly premium would be reduced if they only checked with us. So that's what I think the key message is. Before you write it off as too expensive, make an appointment with an in-person assistant. and get your options before you make a decision, and I guarantee you there's going to be a more affordable option for you.
Hard question, and I may be putting you on the spot, but is there any number? Let's say, let's just pick a person, a man, 35 years old, he's married, has 2 kids, and he wants to go in and look for insurance. What is that going to cost that family, approximately?
So it's a bit tricky because it is based on your income, the household income. So in addition, the zip code, so where you live, age, all matters. So depending on that, you will either find that you're falling in an income where you do get a subsidy that can reduce your monthly premium by 70%. So, for example, I'll just give an example. For a single person, let's say, who makes $30,000 a year, that person, or less, that person will qualify for a monthly tax credit to help reduce the cost of the monthly premium. If that person makes $25,000 and under, they also get help with the out-of-pocket costs, so the copay or the deductible. And so that's a little complicated, but the point is,
there's so many different ways to do this.
Yes, and anyone under $30,000 a year salary is going to get some kind of help.
Now, the other point is that this law, the Affordable Health Care Act, also has a penalty on the other side, doesn't it? If you don't have insurance, and if you say, I just can't afford it, you're going to end up paying anyway in your income taxes.
Yes. And that is
and that number's going way up this year.
It is. It's going to be at its highest. Right now, the penalty, for 2016, it will be $695 per adult in the family that is uninsured. In addition, if there's any children, that is $295 per child in addition to that adult. So the fee will go high.
Talk about scary. That's a scary side, too. But what if people say, well, I can't afford the fine or the fee or whatever you call it, but I can't afford the insurance either, and they're in that middle zone. I'm sure you see those people walk through your door all the time, and they walk out. Do they walk out smiling?
I would like to think that a lot of them do.
Sure.
And it's because, back to the point I was making earlier, before you write it off and before you assume that it's going to be too expensive and you can't do it, speak to a specialist, a certified specialist, to first learn your options and then make a decision. We also go through great length to educate people on the benefits of having health insurance. So if you don't have health insurance and you break your arm, the cost that it would be to not only pay for the medical bills, but on top the penalty is far exceeds what it would cost
per month to have health
insurance.
So we have about 30 left. And if there's one thing you want just the general public to know that doesn't have insurance, other than come and see me, what would be the one thing that they need to remember about this when they walk in? Get over their fear, maybe?
Get over your fear. Don't write it off until you have all the information. Make an informed decision. Beyond January 31st, you are out of luck. You will not be given an opportunity unless you qualify for a special enrollment, which there's various. You get married, you have a child, etc. You lose a job. You can apply. But beyond January 31st, if something were to happen to you, you can't go back and get health insurance to cover you.
All right. Well, I'll tell you what. There's a lot of people, I'm sure, sitting out there wondering what to do. And there's been a lot of confusion, but you made it sound very simple. And I'm sure people think that way when they come in. We're going to talk some more about health care. We've got to talk about not only here in the United States, but worldwide, too, because a lot of things are changing in our health care system. Thanks so much for being here today.
Thank you for having me.
Thanks for helping. All right. When we come back, we're going to explore access to health care right here in San Diego and how the Affordable Care Act is changing the way some of the local clinics operate.